Okay, so our patient has an ulnar collateral ligament tear, and this is our protocol for his rehab. Aaron is a 42-year-old carpenter who is also a coach for his son's Little League baseball team. He has sustained a UCL tear in his throwing arm, and we're trying to rehab him back to throwing so he can continue coaching and also his job as a carpenter.
Aaron has a grade 3 ulnar collateral ligament sprain. The ulnar collateral ligament has 3 bundles: an anterior bundle, a posterior bundle, and a transverse bundle. Aaron tore his anterior bundle. The ulnar collateral ligament limits valgus forces, and he most likely injured his ulnar collateral ligament with excessive valgus force, either from a combination of hammering or throwing or an acute injury of just one. With an ulnar collateral ligament, surgery is recommended. The surgery is called the Tommy John surgery. And the differences between operative and non-operative would be, if he chooses to have the surgery, they take your palmaris longus tendon from the opposite arm, so you're also going to have to think about that while you're rehabbing. The doctor's going to prescribe him a brace, and you're going to have to follow the doctor's orders during the first couple phases and limit the range of motion to what the doctor prescribed. And also, when you first get him in after the surgery, you're going to have to allow for time to recover from the surgery.
So for phase 1 of Aaron's treatment, post-op, our main goals are to limit inflammation, promote healing, decrease pain, and reduce and halt muscular atrophy, reducing deconditioning. For phase 1, we'll use modalities such as cryotherapy, e-stim for pain, and manual therapy such as massage, specifically milking massage for inflammation. For the exercises in phase 1, you can do gripping with a ball, just squeezing. You can also do some wrist range of motion, just flexion and extension. We can also work on core stability so that doesn't decondition, and also the lower body as well.
Phase 2, our goals are to slowly increase his elbow and wrist range of motion, pain-free, of course. We're also going to try to improve his elbow strength, his wrist strength, also taking into account his opposite arm that they pulled the palmaris longus tendon from. We're going to continue to promote healing, and now we're kind of looking upstream and trying to maintain the scapulohumeral rhythm and the strength. The phase 2 exercises that we're going to use are wrist pronation, supination, flexion, extension, starting off with lightweight and progressing as Aaron gets stronger. We're also going to introduce elbow flexion and extension, again adding weight as Aaron gets stronger. And then we start working on the shoulder strengthening, trying to maintain good scapulohumeral rhythm, and working on the rotator cuff muscles. So to do this, we're going to work on scapular elevation, depression, retraction, and protraction, and then also a combination of all of those. So scapular elevation, depression, retraction, pulling them back, and then protraction, trying to pull them forward. And then you can combine them and make circles one way or go circles the other way.
For phase 3, our goals are to gradually increase strength, power, and muscular endurance, and begin increasing neuromuscular control to prepare him for gradual return to sports, occupational, and functional activities. For phase 3, we're going to incorporate what's called the Throwers 10. It is an exercise specifically for return to play for throwers. It works all the major muscles of the shoulder, trying to get that patient back to normal throwing motions. Some components of the Throwers 10 include D2 flexion and extension, so D2 flexion and extension. Then you have internal and external rotation at 0 degrees abduction, And then you can also do it at 90 degrees. I'll show you this way. 90 degrees, abduction, internal, external rotation. And then there's about 20 components or 20 exercises to the thrower's 10 that they include to get the patient back to normal throwing motions.
Phase 4, our goals are to continue to increase strength, power, endurance, and now we're going to focus more on a return to sport and functional and occupational activities. The Phase 4 exercises, now we're doing the advanced thrower's 10, which is similar to the thrower's 10, but now they're on a physio ball to increase proprioception and balance. And now we're actually going to start throwing. And we can start them off with just the throwing motion, and then add in a ball or add in some heavier weights for him to throw. And then we're going to start focusing on him as a carpenter. So we're going to work a lot on the actual motions of hammering and being in a stable position while he's working as a carpenter.